Welcome to your week-by-week pregnancy video series. Let's start by talking about what is happening with baby this week. If you can imagine baby all curled up, she is about the size of a turnip right now. This week, your baby measures just over 18 inches, or about 45.7 centimeters, and weighs approximately 5.5 pounds, or 2.5 kilograms. Baby is almost ready to enter the world, and if she were born today, she would have a very good chance of survival. Baby's lungs, if they are not already fully mature, are very close to being complete. As baby practices breathing, she produces surfactant, a protein that lowers surface tension in the lungs and is essential for healthy lung development. Baby's kidneys are now fully developed, and her tiny but efficient liver is able to process small amounts of waste. The central nervous system, brain, and digestive tract continue to strengthen and mature as well. Although baby will not grow much longer before birth, she will continue to gain weight about half a pound, or a quarter of a kilogram, each week as fat accumulates beneath the skin, around the muscles, and in the abdominal area. Baby has reached a size that makes it harder for her to perform large movements. You should still feel about the same amount of activity, but you may notice fewer full-body movements like flips and twists. While baby's basic physical features are fully developed, she still needs to fine-tune a few important skills before birth, such as sucking. She has been practicing this skill on anything that comes near her mouth, thumbs, fingers, and maybe even a toe or two. Anything that feels even vaguely nipple-like can trigger an instinctive sucking reflex, which actually begins developing as early as 11 weeks. Okay, now let's take a look at what's happening with you this week. Your uterus is now an incredible 1,000 times larger than it was before pregnancy, and you can see it stretching up to just under your ribcage. It's no wonder, considering your baby has grown from a tiny poppy seed into a turnip-sized little one. Even your blood volume has increased significantly by about 50% during the first 2 trimesters. From this point on, your blood volume will remain stable and will gradually return to normal levels after you give birth. By now, most babies have moved into the head-down position, putting pressure on your organs, especially your urinary bladder. This helps explain those frequent bathroom trips you may be experiencing. And if you've noticed a little urine leakage during a sneeze, cough, or even a good laugh, you're certainly not alone. Many women experience this at this stage of pregnancy. Strengthening your pelvic floor muscles with Kegel exercises can help. We've talked about these before, and they can also be very beneficial after delivery by helping your body recover from birth. From here on out, you're likely to feel heavier as your belly continues to grow. If the lack of space in your abdomen is making it uncomfortable to eat large meals, try switching to smaller, more frequent meals throughout the day. Extra weight may also collect in your feet and ankles, so be sure to elevate your feet whenever possible and avoid sitting or standing in one position for long periods of time. If you travel by car often, make sure to stop every 2 to 3 hours to get out, walk around, and stretch for a few minutes. The added weight, aches and pains, and limited space in your abdomen may feel overwhelming at times, but remember, you're getting very close. In just 2 more weeks, you'll officially be considered full-term. While many women don't go into labor until 40 weeks or even later, you're almost there. Your body is preparing by increasing Braxton Hicks contractions, which is completely normal. However, if you experience more than 5 contractions in an hour that last a minute or longer, if your water breaks, or if you begin leaking fluid, head to the hospital right away. You've probably started seeing your doctor more frequently by now. Around this stage of pregnancy, your practitioner will perform a Group B Streptococcus test. This test involves taking a culture with a cotton swab from both the vagina and the rectum. While this bacteria is harmless in adults, it can be very dangerous if passed to the baby during birth and may cause pneumonia, meningitis, or even a blood infection. The bacteria can come and go, and about 10 to 30% of women will test positive. If you do test positive, you will be given antibiotics through and for during labor and delivery. Here are my tips for week 35. It's a good idea to start preparing for your maternity leave if you haven't already. Be sure to research your workplace policies, as well as what your state or country provides. You may also want to consider attending an antenatal class if you haven't looked into one yet. Start learning about both breastfeeding and formula feeding, including their benefits and what to expect from each option. If you choose to breastfeed, talk with your doctor about ways to prepare your body. Some practitioners suggest gently rubbing the nipples with a coarse washcloth to help toughen them slightly. You'll also want to find a nursing bra that is both comfortable and practical. Keep in mind that your breasts may become even larger once your milk comes in. You may also want to look into disposable and reusable diapers, or nappies, and stock up on the option that best fits your lifestyle. This may also be a great time to treat yourself to a pedicure. It can help you relax, and it may be one of the last chances you have to do something just for yourself for a little while. So, that's it for week 35. Thank you for watching.